Hello, my name is Dr. Latanya Benjamin. I am a Board Certified Pediatric Dermatologist. I am also a mother to a very active and happy 5-year-old daughter. Eczema, also known as atopic dermatitis, is a common skin condition that affects 1 in 5 children. Eczema-prone skin is extremely dry and itchy, with occasional red patches that is prone to oozing sores during flare-ups. We still don't know exactly what causes eczema, but researchers believe that it is brought on by a combination of genetics and environmental factors like allergens. The likelihood of having eczema depends on your family history. So what does that mean? Eczema is 40 to 50% more likely to occur in children if one parent has a history of the condition. If both parents suffer from eczema, that probability increases to 50 to 80%. Eczema has a huge impact on the quality of life of my patients and their families. These issues span all ages. They can manifest as sleep disturbances and co-sleeping in infancy, irritability, discipline problems in toddlers and young children, and daytime tiredness and social isolation in adolescents. As you can imagine, the entire family is directly affected by these disruptions, especially the lack of sleep. On average, families will lose 46 minutes of sleep per night from eczema-related symptoms. Unfortunately, there's no cure for eczema, but most children outgrow it by their teenage years. Luckily, there are a variety of treatments available to help mitigate symptoms and make living with the disease easier. Talk with your doctor to find the treatment plan that best suits your child, whether it's steroids or other medications. One of the easiest ways to care for eczema-prone skin is to use an emollient every day. Research shows that patients with a family history of eczema who use a natural emollient like Stelatopia from day 1 to keep skin moisturized can reduce the occurrence of eczema by 52%. I always tell my patients suffering from eczema to take advantage of bath time. Add a bath oil to help moisturize the skin. Keep baths short and use lukewarm water. Make sure to use eczema-specific cleansing products that have been developed just for babies and are free of harsh chemicals and fragrances. I recommend bathing babies every other day when they're young. After each bath, it's important to pat or dab them dry instead of rubbing them like you normally would. Doing this helps avoid skin irritation. Immediately after drying off and while the skin is still supple, apply an emollient all over the body to lock in the moisture. This helps to promote water penetration and reinforces the skin barrier, which keeps the skin moisturized longer. Applying an emollient at least 1 to 2 times a day, every day, is one of the best things you can do for eczema-prone skin. Emollients like Stelatopia line contains gentle yet powerful natural ingredients that protect, replenish, and maintain a healthy, moisturized skin between flare-ups. Unfortunately, eczema is a chronic condition that comes and goes. Despite your best efforts to moisturize the skin, flare-ups can still occur. But don't be discouraged. You should continue to maintain your skincare routine, especially during periods where it looks like the skin is clearing up and actually getting better. Consistency and maintenance are key for eczema-prone skin. Every patient has their own specific triggers that can cause an eczema flare. The key is to identify those triggers and avoid them whenever possible.